Okay, I'd like to introduce Dr. Mark Fitzgerald, a respiratory physician with a special interest in asthma, and that's what we're going to talk about this morning.
Thank you.
So, Dr. Fitzgerald, how would you describe asthma?
So asthma is a disease of the airways with two important components. One is where the muscle in the airway contracts or narrows, and the other one is where the airway becomes inflamed or swollen. When you put both of those features together, you get the characteristic symptoms of asthma. People who cough, get wheeze, and get shortness of breath. The management of asthma focuses on the treatment of both of these two aspects. One is treating the smooth muscle, which is a symptom reliever, and then medications which prevent the inflammation or swelling in the airway, which prevents the primary cause of asthma, which is airway inflammation.
And how important is asthma as a disease in Canada?
Asthma is one of the commonest causes of hospitalization, if not the commonest cause for children. Fortunately, hospitalization rates for asthma generally have declined, but asthma affects 15 to 20% of the population at some stage in their life, so it's a very important chronic disease.
And what are the estimated costs to the Canadian healthcare system?
Asthma is very expensive as a disease, especially for severe asthma. So, for example, in British Columbia, we've shown that 4% of asthma patients in BC contribute to 50% of the direct costs. So that's hospitalization, medication, and physician visits. So we're looking at a very common condition that has a lot of healthcare implications in terms of costs.
Are there more asthmatics now than there were in the past?
We now know that the prevalence of asthma has increased, and that's a multifactorial issue. It's probably in part due to environmental exposures. We know that a lot of antibiotic exposure in childhood potentially affects this. Pollution is likely a factor, but we're not quite clear what this. We probably don't have a single common cause for the increase in prevalence of asthma that we have seen.
What do we know about the geographic distribution of asthma?
So asthma is primarily an urban disease. People in rural areas can get asthma, but there are studies to show that when people move from a rural environment and they come to an urban environment, they're much more likely to develop asthma than in a rural environment. There's obviously caveats to that. So, for example, if you're living in a rural environment and you've got a lot of exposure to wood-burning stoves and pollution that way, it may be a factor. But overall, urban living has been associated with a higher prevalence of asthma to a rural environment.
Thank you, Dr. Fitzgerald.
My pleasure. Thank you.